You may now. Sure.
Okay. Welcome to the HI Pulse webinar for March 19th, 2014. We are very, very pleased to have with us today Lev Gonick, who is the CEO of One Community. Lev has been teaching, working, and living on the net for more than 25 years. I took that from his LinkedIn profile. I could say lots of things about Lev because we are also very we are personal friends, but let me just tell you this. He's the co-founder and CEO of One Community, the award-winning nonprofit organization enabling and celebrating innovation, collaboration, and productivity through next-generation broadband networks. And Lev is going to talk to us today on big data, big networks, and the future of health informatics. Lev, I turn it over to you.
Thanks, Chris. Great to be with you and with your colleagues. Thanks for the opportunity to join with you. I've made some preparatory remarks through a bit of a PowerPoint and trust that it will provide a bit of context. I want to start by sharing with folks that, you know, the world of technology is moving in a way that in many ways is mind-boggling in terms of speed, the speed of innovation, the speed of disruption, and its impact around all of our sort of 19th and 20th century institutions are really quite remarkable. That is to say, we live in a remarkable time. Here I show you a hype curve of some of the technology innovation that's going on. Really simply to say that you know, a day doesn't go by when there isn't a new innovation being introduced into the marketplace, and many of them are involved right now in the broad category of health informatics. And today, obviously, I'm going to try to provide a little bit of context and some insight, if I can, of the intersection of big data, big networks, and the world of health informatics as a profession. I want to start with a little bit of a overview. Some of you may well have seen this from HBR, from the Harvard Business Review, but it provides, I think, 10 or 11 kind of key megatrends that I think are worth thinking about in general, but also in particular as it relates to the world of health informatics. Because as I was going through this deck for today, not one of the 11 trends was somehow not relevant to the world of health informatics. And the very first piece to share with you is obviously that as the innovation that we're talking about and that we largely think of as being somehow centered to the OECD countries, to the US and Europe and the like, the truth of the matter is that there is an explosion of demand in the emerging economies, and that with that will come Western disease, and with Western disease we'll see the opportunity for the introduction of a range of market-based solutions, along with a very interesting arc of activity that will proceed, no doubt, with the integration of more traditional medicine along the way. But the first megatrend here is that health informatics is intimately tied up in the explosion of soaring interest in the emerging economies in the area of health, and with it there will come lots of opportunities to see emerging economies as a place for health informatics, but also a place where we will see innovation actually taking place, as the price point for the delivery of health informatics will be radically different in India than it will be in Northeast Ohio. The second piece here is obviously core to what I know a lot of folks in the world of health informatics are tuned into. And of course, we already know that we are at the point of a $1,000 personal genome or opportunities that are there. And with that, obviously, are huge opportunities for our world. But I think the key point that I wanted here was less about the health opportunity, which is, of course, to reduce significantly the deaths that basically happen because we are generalizing our delivery, and more to underscore that in the world of health informatics, your world is not separate from the broader set of considerations around privacy and cost-benefit issues, and we certainly need to be mindful of that. The third piece here, again, I think is intimately relevant to the world of health informatics, and that is aging populations. and really what that does to our capacity to support the healthcare system and maintaining the commitment to quality of life. And actually, of course, who gets to decide is a serious set of challenges for all of us. But again, to underscore that your world is not separate from the ethical considerations that go into the broader challenge of a society that is continuing to live longer. Again, no doubt a topic that many of you are engaged in and working on. It has to do with how to use health informatics to dramatically shift the cost curve. Obviously here we have a challenge in our country, dramatically different than in much of the rest of the world, but the overall impact to the cost of health informatics starts with an additive, not a subtraction from the cost of healthcare. That is to say, introducing healthcare costs that take advantage of the world of health informatics will, at the beginning, for most enterprises, represent additional costs, and that, of course, represents all kinds of interesting challenges within organizations who are challenged with overall reducing costs. And then here we come, we health informaticists, saying, but if only you had made the following several tens of millions of dollars of investment, we could radically shift the cost curve, and that oftentimes is a hard sell. Another sort of broad challenge here, and again, a place where health informatics has done a lot of work in early warning systems around pandemics. Obviously, this we think of as somehow being consequential only to the other side of the world. On the contrary, I think that we'll be seeing the world of health informatics being able to provide us with lots of important urban and rural insights as it relates to the outbreak of any number of conditions, including and up to a pandemic. I'm running through these very quickly because, in fact, these are really only contextual, and to share that, in fact, you know, all of us are engaged in thinking about any specific health ecosystem opportunity in a broader context. And so, again, environmental challenges and the challenges of, you know, our cars spewing and belching air toxins into the air creates all kinds of challenges, leading to and including lots of premature deaths just as a result of air pollution. Again, a huge challenge for you folks interested in health informatics is really how to be thinking about evidence-based medicine and really trying to figure out how to not only reduce the cost of death-related or severe health-related challenges inside the actual hospital setting, but thinking about it as well in the context of population activities. There are a huge challenge out there, again, with respect to primary physicians across the country, and that's a huge issue for us. Again, I think as we talk about health informatics through the afternoon, we'll come back to this one as well. You know, here is the consequence of the success of much of what health informatics can do. The other soft underside is that, you know, while we can increase the longevity and lifespan, there is a cost towards the end of life, which is dramatic, around which we don't have good conversations in our society about the impact that it has not only on the individual who's coming to end of life. The fact that we can use modern medicine to keep people alive is in and of itself an amazing feat of science, and on the other hand, of course, there is a dramatic cost in dollars and cents, and also a big challenge around the quality of life. Again, we have a big shift which has been making the news this past weekend. A lot of conversation around the way billionaires are impacting science. Obviously, there is a significant opportunity here as philanthropic organizations with an entrepreneurial spin are interested in the world of health informatics in a big way, so there is certainly upside opportunity. It certainly, though, is skewing a lot of the core research in the world of health, and I think we need to be mindful of that. And again, just the last one that I picked out here is obviously, you know, there is a huge opportunity to arrest some of the preventable diseases here by targeting, rather than sort of generalized healthcare interventions, targeting with important insights from the world of health informatics. Well, that, had we started on time, I would have probably spent another 5 minutes on that, but just to kind of get us to then the conversation that we want to have today around big data to start with. And it may or may not be obvious to all of you who are in the world of health informatics that the world that you occupy has unleashed a tsunami of challenges in the world of data and networks and technology, and we want to talk a little bit about that today. Let's just start with the fact that most of, certainly Chris and I can recall the day when the computer industry really just began. The amount of data required to send basically small traditional data set, really for the first decade, it was very, very simple. It was just really just binary code of ones and O's. But as noted here, every 10 years we seem to get about 100x increase in the actual demands associated with it. So again, the very first of which was the idea of object-based programming, and the first images that appeared on our computer screens represented obviously a significant increase from 500 kilobits to about 1,000, about a meg or so. Audio, again unfolds, and obviously that increases demand. In the last, I'd say, 15 years or so, we get a huge explosion in video, and the world of health informatics is directly related to this. Health informatics becomes possible when, in fact, the video and imaging, which is a core part of that which is being analyzed, becomes possible. There is an explosion, really, in the demand for bandwidth and storage. And what is coming is, again, a tenfold increase in real high definition, 4K transmission, and the like. And as I will share through the presentation, while marvelous, the demands for supporting that capacity are really out of breath when it comes to trying to keep up with the capacity, much of which is essentially at this point being driven by not only the entertainment business but also the world of health informatics. So here's a kind of way of kind of summarizing those huge trends that we've been referencing, and sort of point you to the middle of the x-axis to indicate that really in terms of the volume of storage that we consume, we're about to hit an inflection point, and most of it is around essentially the sensors and devices that can in real time provide us with incredibly important data relevant to the work that we do. Social media here includes video. You can see those being sort of the largest parts of demand in terms of storage coming forward. And so right in front of us is a spectacular data-centered challenge. It's the world of zettabytes. You will have heard of megabytes and perhaps petabytes. Beyond that really is an explosion of zettabyte scale activity. Much of that is being driven by the opportunity of creating compelling, life-saving, and advanced research activities along the way to try to give you a sort of a sense of one way of thinking about this. A lot of research does not move over the network. A lot of it is resident inside a lab or inside a healthcare setting. But certainly in the next 3 or 4 years, we're going to see a huge amount of traffic needing to traverse our broadband networks. Again, to give you a sense of how much that is, really only 4 or 5 years ago, IP traffic on our internet was about 120 exabytes. That's the one amount of unit of analysis before a zettabyte. We are on course for a 10 or 12x increase in the next 4 or 5 years, about 1 billion DVDs per day for the entire year, to kind of give you a sense of how much data needs to move through that environment. So that provides us with a sense of a huge demand being generated by rich media, image-intensive media, the ability to really begin to really drive a huge amount of the web-related, internet-delivered services. And so here gives you a sense of just how much over the next period of time. In the bottom set of each of the bars here is the amount of internet video. Think here of very much your kind of video, the video that you experience in a healthcare setting, along with that which we consume as consumers at our homes. More than 70% of all of the internet is moving to video over the very, very short time frame here. Almost all of the traditional internet, as we know it, web and data, is shrinking to less than 20% of all of the broadband that is out there. And that becomes a transformation, a flipping on its head of the requirements of broadband networks to support a video-centered world, an imaging-rich world, a world where CT scans, X-rays, and other things move in real time, not simply as file transfers, but for being able to manipulate and analyze in real time. A lot of folks have stayed, Lev, but what's in reality, while all of this big data is interesting, we all want stuff, including in the world of health informatics, to be able to basically tackle it all on our smart pad or our smartphone along the way. And here too, we have a huge demand in consumption of data on all of these small form factors that are out there. Basically, a three times plus increase over a relatively short period of time. And you and I are probably the most guilty of the parties in this space. And as the world of health informatics plays here too, you want the convenience of not only for yourself, but for those that you work with in the healthcare setting to be able to show, manipulate, and analyze in real time. This too requires a huge amount of bandwidth, as almost all of this data resides somewhere, but not on the small form factor itself along the way. So here then is the nutshell of what and I'll take a couple of extra moments to walk you through this, because this is the challenge that I wanted to share when Chris asked me to speak to you, with you about the world of health informatics. It strikes me that this is the nut of the problem. There is a huge increase over a relatively small period from about 1990 through to just around the internet boom in computing capabilities. That's signified by the first line. And that continues to grow exponentially. Our ability to use not only desktop computing and even mobile computing, but more impactful, it's parallel processing and supercomputing. We are on a significant exponential rise in computing capability. I've spent a chunk of time this afternoon sharing with you that storage demands are on an exponential rise. Again, having gone through a relatively slow incubation period for perhaps the first 10 years or so, but in the last 15 years, we are on a meteoric rise. The point of the work that I do is represented in the third line, and that is our broadband connectivity. You can see that for basically the last dozen, maybe 14 years now, broadband connectivity in terms of its growth and innovation has been completely stagnant. Completely stagnant, in this country in particular. And that means that while a huge amount of innovation is taking place in health informatics and in other science, one of the most important rate-limiting challenges right now is that all of our innovation is developed in the context of constrained bandwidth. And the work that I've been involved with over the last decade with Chris and many others has been to bring this kind of reality forward and indicate that as a country, we cannot be globally competitive. As a region here in Northeast Ohio, we can't hope to be globally competitive if we don't actually change the underlying infrastructure, just like we've seen a change in the underlying compute and the underlying storage infrastructure, we have to change the underlying infrastructure of broadband, and that is the development of a new transportation system not based on DSL or cable modem, not based on coax or copper, but one based on glass, broadly known around the world as fiber optics. And you can kind of see that fiber optic innovation really, at least in my view, and in sort of the summary chart, speaks to the huge opportunity to get on an innovation curve here. And so the one slide that I have about what I do with my colleagues here at One Community is that over the last decade, and in particular the last 3.5 years, we have built out the nation's largest community-owned fiber optic, all fiber optic network, supporting thousands of institutions, including 165 healthcare facilities that are on our network, touching 24 counties here in Northeast Ohio, focused and dedicated to public benefit organizations to try to unleash the innovation curve to support mission-related activity, whether that's in healthcare, education, government services, museums, libraries, and the like. And that's certainly a key to the activity set that we're engaged in. So again, to kind of summarize this part, and then I just have one final section to share with you today. I mean, obviously, there is going to be worldwide continuing growth in the amount of consumers. We know that as consumers come online, we are not, nor have we been for a long time, in a single device world. The number of devices will actually outpace the number of users. There'll probably be somewhere between 4 and 6 devices for every consumer out there. Storage capacity will grow enormously. Demand for broadband services, that is to say network services, will exponentially grow. And the challenge that we have is how to think about building capacity to support that innovation so that it doesn't represent a brick wall in which all of this forward momentum comes to a screeching halt, or around which we then have to do a serious amount of work to continue to work with constrained bandwidth as the core feature in designing our health informatics world. I want to shift gears to the third section and just share with you what may be well aware to the webinar community that's watching live and or who watch on replay. And that is that there is a huge opportunity for those interested in the intersection of technology innovation and health delivery, health research, and analytical work to really take advantage of a moment in time. This is pioneering days. This is really a huge opportunity, and I want to kind of share it in the following set of slides, which are fairly practically focused. And so let's just sort of start with this most important piece here. This is in some ways the story in a nutshell. One representation of everything I've said in the first 20 minutes of my talk focuses in on the first arc of activity. That is, there is a massive and continuing growth in stored data, represented in everything that we've said. And yet, the workforce itself across the country is growing, but nowhere near the rate of growth, the incline of the line. And that is in some ways a national challenge, and at the same time an opportunity for those involved in the world, especially in the world of health informatics, which is of course an even smaller subset of the workforce, and yet healthcare represents a disproportionate amount of the demand for data storage, and the like. So again, if I had data for health informatics, the growth rates for data for storage would be significantly higher than 28%, and the analyst workforce would be, in terms of growth, would be even smaller than the 5 to 6% you see represented here. And of course, there are, I think, important opportunities. Health informatics oftentimes has a bit of a challenge sorting through what the sort of range of opportunity is. There is a continuum of opportunities related to the world of health informatics. Here is one way to kind of take a look at it. as I said, a fairly practical way to take a look at it, from entry level through mid-range clinician and manager levels, right through to consulting and high-level administrative opportunities that are there that are represented in, again, market surveys on entry, starting salary kinds of costs. And, these are only to suggest to you that on a national market basis, these are very healthy salaries. And of course, that there are lots of settings for health informaticists as well. And again, this kind of gives it a look at it with different sort of segments along the way that sort of speak to the role of the health informaticist in these different settings, from home to consulting along the way, and the dollars associated with it. All right, I'm just going to say that I have just 2 more slides to share with you today. And this is a bit of a word cloud that I put together with another audience interested in a similar question of analytical capacity associated with the explosion of data and storage and broadband connectivity, and outline to you that, at least in my mind, the handful of large takeaways here have to do with data and standards. And while the other pieces are really very important in terms of other values, it seems to me that the idea of data standards is something that the health informatics community would do well to kind of go back and look at and understand the history of what has led us to rate-limiting challenges in the past. And oftentimes they come back to the lack of or the continuous contention around data standards. Rather than values around openness, traditionally we have had challenges around proprietary solutions. Instead of availability, we have had closed systems. In terms of collaborative data standards, we have again had systems that are closed and locked in proprietary solutions. They've been cloaked instead of transparent. They've been complex instead of simple. They've been over-bloated instead of agile. These are realities which I guess I would say are not only historical. As I look at the world of health informatics today, at least in my view, that is in fact a lot of what is out there in the world of health informatics. Sounds a lot like a lot of earlier conversations thus far in a lot of other spaces. And if we're going to accelerate the efforts underway to create a viable, sustainable industry full of professionals who have forward-leaning capabilities for well-paying jobs with lots of iterations for innovation, startup activity, as well as enterprise deployment of their talents, it seems to me that there needs to be strong, consistent advocacy for data standards that are out there, and to really begin to innovate around the handful of common data sets that are available out there while we continue to do our daily work inside the trenches of our particular healthcare setting, which are more times than not around closed systems. And I conclude with the one slide around, again, around which I think more innovation needs to take place, but around which I think there is an opportunity for health informaticists to lead, and that has to do with data.gov, an effort here to really begin to pull together data from across the federal agencies and more at state levels, data that I think offers us some insight as to how communities can be built around competing enterprises. One does not have to be developing a co-op or nonprofit model like One Community, but the core of this effort here around data.gov is actually empowering the community by committing to open data standards that are shared, that provide for critically important activities to take place, and around which some data set sharing can actually unfold to underscore and draw the power of that technology around, again, not only the technical pieces of the activity set, but also the impact that it can have on patient care, on research activity, and on institutional transformation to attend to some of the 10 or 11 big megatrends that I started my 40 minutes with you on. So with that, Chris, I think we're at exactly quarter to the hour. I'll pass it back to you and see if you or any of your colleagues have any comments or questions.
Well, I actually have two questions. My first question is, I'm not sure that you can answer it, but the question is, why are we so far behind other countries in implementing internet connections, broadband to our rural areas? I mean, is it because the government has not put enough money into it, or is it because of private enterprise?
Well, there are a host of answers here, Chris, and I will just offer you a couple of insights. Let's start with those who would sort of say, you know what, it's a really tough problem to solve because we're one big country, and a lot of the bigness comes in our rural reality. So that that is one position that is sort of always sort of marched across the stage as one of the challenges that are out there. And we have limited public dollars to spend through the universal service fees that we all pay for our, basically for our phone bills, and of course all of that is kind of all obsolete because our federal agency responsible for framing policy is just now beginning to figure out how to get beyond the world of telephony to realize that we have to be building up broadband infrastructure. The second piece, just to sort of share with you, is that obviously there are entrenched interests, as there are in every economy. There are entrenched interests, and the truth of the matter is that those who own the disproportionate amount of broadband infrastructure in the country have an annuity that we all pay for as individual consumers, and that our organizations pay for, and we like to basically swear at the cable man, or say what lousy service we get from our DSL provider. But the truth of the matter is that these are annuities that we continue to pay $40 to $80 to even $100 a month for, where elsewhere in the world that infrastructure transformation is well underway, and competition in the marketplace for alternative delivery systems has, even in this country, led to what you would expect in the marketplace, namely the incumbents basically saying, if competition gets into the marketplace, we have no choice but to compete. And that leads to reduced prices and further investment in infrastructure. And there are always going to be high-cost, last-mile challenges in the country. We oftentimes, from a policy perspective, get totally wrapped up in how to deal with the very last house on the country road, without realizing that the best way to think about that is to briefly suspend that question and ask, how do we get to the local village on the road to the last house on the country road? And that is really how we have to build out the infrastructure in the country.
One of the other things that I think about a lot with all the money that was put into the High Tech Act and in terms of getting physicians out there to subscribe to electronic health records. How are organizations like One Community partnering with the feds to get that health care out there to the rural areas? I mean, I know about the project down on Hessler, and that certainly is a way to start. And that is getting to the village before we get to the last house. But are there any public-private partnerships that are being built up to solve that problem?
Well, I think there are a couple of things there, Chris. I'd share with you that One Community has, with support from the Federal Communications Commission, built out a number of rural health care facilities. That is to say, we've built connectivity, our kind of connectivity, not copper, not twisted pair, but fiber services out to rural healthcare facilities. And healthcare professionals in that space are able to take advantage of services that they can deliver to their patients and communities in a way that would be no different than being in the sort of most urban and modern of settings.
Mm-hmm.
So that's sort of one continuing effort that's underway. There are some funds called the Connect America funds, which are focused in at least a significant measure on rural broadband connectivity innovation, and I can think of no more important, at least twin activities than rural healthcare and wellness and education, which I hope will drive that activity. As far as kind of what we can do to innovate in fiber to the home, which can obviously take place in rural settings, I certainly, and we are at One Community involved in a number of activities focused in on that. It does strike us that from a relatively small nonprofit organization like One Community, our best effort is really to be a kind of pilot of the art of the possible in the settings where we have more dense deployment of our own infrastructure, and that turns out to be in the urban settings. And in those urban settings, there are across the country really just a handful of cities, large cities, metropolitan cities, working on fiber to the home. There are some really important ones to keep an eye on: Chattanooga, Lafayette, and now Kansas City, beginning to deploy basically pervasive fiber services. There are a lot of smaller communities across the country that have deployed, hundreds of them, who have deployed fiber services that are out there, and there is certainly some innovation going out there. But here, Chris, I would point out that we actually have a bit of a market gap, because as I've shared in today's presentation, a lot of the innovation that's taken place in healthcare delivery through the high-tech related activities has really been designed against the constrained broadband availability, which is to say, if you're a healthcare provider and or patient, the most that's required for meaningful use and the High-Tech Act right now is really an electronic forum.
Right.
And so what do you know? We can actually use crappy broadband to transmit electronic forms. In truth, as fiber gets deployed into even the node, into the village, and either fiber or other transportation is afforded to the last house at the end of the block or at the end of the farm road, the truth is that more capabilities for innovative and truly meaningful use can be entertained, but here we have a bit of a gap in the marketplace, because as the feds have to actually get rulemaking pulled together and meaningful policy pulled together, they really had to dumb down to pretty much the lowest common denominator, although in truth, it's a little bit better than chicken wire when it comes to broadband connectivity, but not much better than chicken wire.
I love the analogy, and I think it's absolutely on point. I think that one of the things that people are beginning to focus on is, how do we get everything out to the rural communities the way we have to? And obviously we tend to blame Comcast and Time Warner and all of the private organizations, but I think there's so much more that needs to be done, and I think there's also an awareness that we have to bring to the forefront.
Indeed, I couldn't agree more with you. And let's be clear that Comcast, AT&T, and all the incumbents have really a very, very important, arguably the most important mission they have is to return value to their shareholders. And without public subsidy, there is currently no obvious way to deliver a high-cost requirement to rural America. And that is, so the question that sits in front of all of us right now, and certainly One Community is very engaged because it matters to us and to our mission, is, there are alternatives to the incumbent providers once we acknowledge that we need to find public investments to make sure that our rural communities have broadband not only for surfing the web and sending emails, but for their health and wellness and for ongoing monitoring of health in the home, and they have those rights as citizens as much as anybody else, and that typically community-based broadband providers are closer to the needs of the community than national or global corporations who, as we know well, have pretty much a one-size-fits-all philosophy, and around which, they will deliver enormous value to their shareholders once they can actually standardize and provide, typically with a lot of public subsidy, a solution that they can drive out to the rural marketplace.
Mm-hmm. All right. Well, we're getting close to the top of the hour. I wanted to see if there's any other questions out there from anyone else online. If not, I'm sure that you will have questions as we make this rebroadcast available. I would like to thank you so much for doing this for us. This is something that, as I was listening to you today, one of the things I'm going to do is make this absolutely mandatory that my students in my policy class listen to, because I think it's absolutely crucial they know what's going on. And I'd love to thank you for what you have done today. Oh, wait, I think we might have one other question.
Okay.
Nicole, did you have a question? She's on mute, I can see.
Right.
I guess not. I guess she doesn't have a question.
Okay.
Okay. Well, I thank you very much, Lev. Thank you for taking time out of your day, and we appreciate it greatly.
All the best. Take care.
Thank you. Bye-bye.